webinar about family planning on our Gender and Society subject. This is your host / resource speaker, Duchess, Heredia, and Andaya. Along with me are my co-resource speakers, Mr. Jonathan Catalan and Ms. Naomi Caneda. If there are questions regarding on this webinar, I encourage everyone to send your questions on the email address shown here. On this juncture, I would like to present to everyone the webinar overview. It consists of the introduction of family planning on our top 5 pick of contraceptives and relaying of the different aspects of the following contraceptives. So what is family planning? Family planning allows people to attain their desired number of children, if any, and to determine the spacing of their pregnancies. It is achieved through the use of contraceptive methods and the treatment for infertility. Benefits of practicing family planning. So we only provided 7, so here it is. Number 1, better financial situation. So in the family, if there are lesser people, there is lesser people to provide financial aid. Second, can provide the basic needs of each family member. So, just like number 1, if there are lesser family members, there are lesser people to provide the basic needs. So if in this family we have this salary, we can provide more basic needs for everyone because there are lesser people to provide the basic needs. Third, enhance health by preventing unplanned pregnancy, abortions, and sexually transmitted diseases. So there are specific contraceptives that deals with that can lessen the STDs or sexually transmitted diseases. We will discuss it further on. So number 4, more time for educational pursuits with fewer children leads to improved work opportunities. So because you have fewer children, you can focus more on yourself. Okay, number 5, good prenatal care and nutrition. So it is very important for pregnant women to eat healthy food during their pregnancy. So if you have lesser people to provide and you can solo or you can enjoy more your salary for yourself, so you can provide a good prenatal care and nutrition for yourself. Number 6, better conducive atmosphere for children's physical growth and development. So in this, parents can provide more attention for their children, thus giving better conducive atmosphere for the children's physical growth. Number 7, lastly, it enables them to give a satisfying sex life without the concern of unintended pregnancy or sexually transmitted diseases. So, I already talked this on the third benefit. So, we will discuss it further on. I have mentioned earlier the word contraceptive. So, what is a contraceptive? Also known as a birth control, it is the use of medicines, devices, or surgery to prevent pregnancy. There are many different types. Some are reversible, while others are permanent. Some types can also help prevent sexually transmitted diseases. So here are our top 5 pick of contraceptives. Number 1 is the condom, 2 the pill, 3 intrauterine device or IUD, 4th implant, and 5 is the calendar method. Condoms would be discussed by Mr. Jonathan Catalan.
So, to begin with, the first top 5 contraceptives, which is condom. So, we all know that condom is common, especially sa mga male, and this is intended for all the males age 16 and above. So most of the schools and any that allow those boys to bring and to have these kind of contraceptives to prevent the pregnancy, as what by the definition in which a condom is a thin, loose fitting pouch or sheath that protects against sexually transmitted disease or infections or STIs. As a barrier method of birth control, contraceptions, condoms prevent pregnancy by keeping semen, sperm-filled fluid from entering the vagina and fertilizing the eggs. So, the definition said that a condom is a thin, but it is thin because but there's a lot of type of condom out there that is kwan siya ning murag baga siya. One of the example of it is the Dorex, since kwan siya baga siya but it is very expensive. But it is kwan sad siya effective and efficient.
So let's moving forward to the guidelines and procedure on how to use the condom. So first is take the condom out of the packet, being careful not to tear it with jewelry or fingernail. Do not open the packet with your teeth. Place the condom over the tip of the erect penis. Next is, if there's teeth on the end of the condom, use your thumb and forefinger to squeeze the air out of it. So the next guidelines and procedure on how to use a condom is gently roll the condom down to the base of the penis. Then if the condom will not roll down, you may be holding it the wrong way round. If these things happen, it may have sperm on it. So throw it away and try again with a new one. So condom is a kind of contraceptive that can be used only once. So we need to be careful in terms of using that kind of contraceptive, since it is very sensitive by its the kwan ni yang itsura basta mabuslot kay there's a possibility nga kwan ni makabuntis siya.
To begin with the advantages of the condoms. So first is, when used correctly and consistently, they are a reliable method of preventing pregnancy and protecting both partners from STI, including chlamydia, gonorrhea, and HIV. So it is a kind of condom is a kind of contraceptive that would help to prevent HIV and STI. Next, you only need to use them when you have sex. They do not need advanced preparations and are suitable for unplanned sex. So you can use this one when you are planning to have sex with your partner. In most cases, there are no medical side effects from using condoms. They are easy to get hold of and come in a variety shape, size, and flavors. So we'll know that, as what I have said, that condom have different types in terms of its sizes, shapes, and flavors. So sa flavors, there's a lot of flavors which are example of it are the strawberry, the chocolates, the milk, and so much more. So now let's proceed to the disadvantages of the contraceptive condom. So some couples find that using condoms interrupts sex. To get around this, try to make using a condom part of foreplay. Condoms are very strong but may split or tear if not used properly. If this happens to you, practice putting them on so you could use using them. The next is, some people may be allergic to latex, plastic, or spermicides, but you can get condoms that are less likely to cause allergic reactions. So, since we already know on how to use and its advantages and disadvantages of the contraceptive condom, let's moving forward to the place where to get condoms. So you can get condoms for free even if you're under 16 from. So as what I've said a while ago, that ni age 16 and above are those people who are applicable to have this kind of contraceptives. So the first place where to get condoms is the contraceptions clinics. Contraceptives clinic it is common in school, in barangay, and in community. Next is the sexual health or genitourinary medicine or clinics, some GP surgery, some young people services. So the next is pharmacies, supermarkets, websites. So kabalo naman ta ani nga ning buying condom dali ra nato makita ni sa mga pharmacies, supermarkets, websites, and any other branches nga which related to the mga pharmacies, mga tablets. How much does it cost? So, a pack of condoms costs about 50 pesos and upwards. So, as we all know nga, murag naka-experience naman tanin no, nga kaning mamalit og condom, especially sa mga males. So, condom kay pack, every pack contain 3 pieces of condom. Bisan asa pa na nimo siya paliton, tag 3, sa usa ka pack kay tulog na siya kabuksulod. So, let's moving forward to the next top 5 contraceptive, which is pill. So, my question is, what is the pill or pills? So, the pill is a type of contraceptions that contains hormones that prevent pregnancy. People call it the pill because it comes in pill form rather. Women take the pill orally by mouth once a day. The pill is most effective when you take it. So, as what I have said also a while ago that pill is a kind of contraceptives that you take every day, but if you fail to take this kind of contraceptives, it is dako gyud siya possibility nga prohan gyud siya nga mabuntis. So the next is how effective is condom? Pill. So the pill has the potential to be 99% effective at preventing pregnancy if you take it without fail. Meaning you don't forget to take the pill for even a day or two. However, taking a pill perfectly can be difficult, which is why 9 out of 100 women who use the pill will have an unintended pregnancy every year. So, as what by the researcher gathered nga data, so 99% daw nga effective ang kani nga contraceptives which is pill. And so next is, what are the advantages of taking the pill? So, the first is regulate or lighten menstruations. The next is prevent anemia by making periods lighter or shorter. The next is the lessen menstrual cramps or dysmenorrhea. So, maybe this kind of aspect, most of the women or nga who are already kanang diyan na sa family nga moro gyud naka-experience ani, but since ang pill is a kind of contraceptive which is very effective according to the gathered data by the researcher. So the next is the disadvantages of taking this kind of contraceptive with this pill. So birth control pill side effects may include, the first is headaches, breast tenderness, nausea or sometimes vomiting, bleeding between periods. So sometimes those women who are taking this kind of contraceptive feel headache, breast tenderness, nausea, bleeding between periods. So the next is where to get birth control pills. So you need prescriptions for birth control pills. You can get a prescriptions from a doctor or nurse at a doctor's office, health clinic, or you call local Planned Parenthood health center. In a few states, you can even get a prescriptions online or directly from a pharmacist. So the next is how much does it cost? So birth control pills start at 100 pesos. So 100 pesos, but it is kuman na siya. So 100 pesos na siya ay dakan man sa na siya nga tablets nga imong ma-take, which is kuan gid siya ni effective gid siya labi na sa mga women to avoid the pregnancy and also sa kanang maka-help to prevent sa kwan ni parang dili kay mudagan ba ang bata.
Hello and welcome to today's session. My name is Naomi Caneda and I'm going to discuss about the other two contraceptive methods, which are the intrauterine device and the contraceptive implant. Now let's start off with the intrauterine device. Now what is intrauterine device? This device is also called as IUD for shorter term. This is a small plastic T-shaped device which mainly used for birth control. So this device is inserted through the uterus where it stays to prevent the pregnancy. This type of contraception can effectively work to 99%. So this method has two types available, the copper IUD and the hormonal IUD. Now this type of method is considered as one of the most effective contraception because this will last for 5 to 10 years. How does IUD works? IUD prevents pregnancy by blocking the sperm to fertilize the egg, and it also thickens the cervical mucus and thins the uterine lining as well. So for some cases, it also stops the ovulation. So when the releasing of an egg during monthly cycle. So it also said that it can help reduce blood flow if you're having a heavy and painful menstruation or periods. So this device can only be inserted to you by the help or an assistance of a professional nurse or a doctor for safety purposes lang. Now let's proceed to the advantages and disadvantages of this device. Advantages: it is a 99% effective when it comes to preventing a pregnancy. So 99% siya. So it is very well said na effective siya. So they can last for 5 to 10 years. This is much more convenient than buying those kanang contraception na kuan na for daily use. They are said to be safe even if you are breastfeeding. So there are other users na who have kanang nanay mga anak and then have decided to undergo this kind of method. Pwede siya if nag-breastfeed hapon siya. So once this advice is inserted to you, you don't need to do anything except for having a monthly checking to ensure that the device is still in their correct position. So you still have to check if naapa ba siya sa sakto na position, as it were kung asa siya na position pag-insert. And if you're having menstruation, you can also feel less painful. So they said na makatabang pud siya if you're having a kanang, as I've said earlier, painful na menstruation. Makaless siya sa sakit or kanang mag-cramps. So let's move on to the disadvantages. It doesn't offer any protection against STIs. So as much as possible, if you're having an intercourse with your partner, to be safe lang, to ensure safety lang, I think you still need to use other contraceptive such as condom. So when inserting this device, expect rather that it would be a little painful since it's going to be inside of you. Ang pag-process, pag-insert is sakit. So some people who undergoes this method had experienced infections or side effects. As per the continuation of my first discussion, let's proceed to the last kind of contraception, which is the contraceptive implant. Now, what is contraceptive implant? This implant is for long-term use, and it is a birth control option for women. So this is a flexible plastic rod which is about the size of a matchstick. So this will be placed under the skin of your upper arm. So ari siya dinhi. Diri siya isud or insert. Now this contraception is more than 99% effective when it comes to preventing pregnancy and can also last for about 3 to 5 years also. Now, how this device works? The implant functioned by not allowing the ovaries to release an egg each month. It also thickens the fluid around the cervix or the opening of the uterus or sa imong womb, which also prevents the sperm from getting inside. Now, this kind of contraceptive typically stops ovulation as well, and which also releases tons of hormones into your bloodstream to prevent pregnancy pod. Now, when does it start to be effective? The effectiveness rate starts when it's inserted to your arm, which it would take up 7 days to work. So, after ma-insert ni sa imong upper arm, you still have to wait for 7 days to work kanang para ma-process siya, mo-work siya. But take note, this will only depends on the timing of your menstrual period. So where can I get the implant? If you are planning to undergo this kind of contraception, you have to make sure that you are being assisted by a professional doctor or a nurse, because they will be the one who provide a note for you to get the implant inserted. So you have to make sure na licensed and professional ang imong clinic nga adtuan baron, so that there will be no problems ahead if mag-implant na sa device. Now let's know what are the advantages and the disadvantages of this implant. Advantages are, first, it is one of the most effective method of contraception because it is a 99% effective, so it is expected na it works very well. Second, users of this method have no experience of having vaginal bleeding. So, wala sila na experience na mga any side effects like vaginal bleeding. Third, periods can less be painful too. So, as I've said sa first na kuan, which is the IUD, maka-less po siya painful. Same po sa kaning contraceptive na implant. It is for long-term use, so you can enjoy yourself in 3 to 5 years. So, in those years, you're free from getting pregnant. And the last one is also you don't need to think of having contraception for everyday use. So, as I've said, since naka-implant naman siya inside the imong body, you don't need to think of, for example, buying those other kinds of contraceptives such as condoms. But if it's really needed, then you really have to buy one. Now, for the disadvantages, first, users of this method may experience temporary side effects during the first few months, which included the following. So, maka-experience ka og headaches, nausea, breast tenderness, and mood swings. Second, your menstrual cycle may go irregular or kung pwede magani kay mo-stop siya og kalit. Third, pain or bruising under your arm where the implant is inserted can be visible too. So, ang upper arm nimo where the implant is inserted na ay tendency na maghubag or malagom siya. That's one of the side effects. And fourth, last would be small risk of infection if not properly checked. So ang na-implant or akong asa gi-insert ang implant na ay tendency na ma-infect siya if wala natarong og insert baron or kung wala ba natarong og kanang aid.
Okay, so for the calendar method, what is the calendar method? The calendar method helps you predict your fertile days by tracking the length of your menstrual cycles over several months. So how to use the calendar method? You need to keep track of the length of your menstrual cycle for at least 6 periods. You can do this with a regular calendar or period tracking app. So the period tracking app, you can download this in the Play Store or App Store. So how to use the calendar method? Number 1, mark the first day of your period. This is day 1. Then mark the first day of your next period. Second step, count the total number of days between each cycle. Third, if all of your cycles are shorter than 27 days, the calendar method won't be accurate for you. So here is a visual representation or example. So in the first day of your period, it starts on January 5. And the number of cycle is 27. For January 3, the number of cycle is 28. March 3, 30. April 2, 31. May 3, 28. And June 2 is 27. What are the safe days to have sex? To predict the fertile days in your current cycle, find the shortest cycle in your past record. Subtract 18 from the total number of days in that cycle. Count the number from day 1 of your current cycle and mark that day with an X. The day marked X is the first fertile day. So here we can identify that the least number of cycle is 27, which has the first day of period of June 2. So 27 minus 18 is 9. So you can see that June 2 is a Saturday. From there on, we will count 9 days. So 1, 2, 3, 4, 5, 6, 7, 8, 9. It stops at June 10. So on that day, it is your first fertile day. So that is an unsafe day to have sex because you can get pregnant. But the rest of the day from June 2 to June 9 is your safe days. Next is to predict the last fertile day in your current cycle. Find the longest cycle in your record, subtract 11 from the total number of days in that cycle, count that number from day 1, the first day of your period, of your current cycle, and mark that day with an X. Include day 1 when you count. The day marked X is your last fertile day. So, the longest cycle in your record in this example is 31, which has the first day of period of April 2. So we will minus 11 to 31, which would equate to 20. Okay. So, let's go to the June calendar. We would count 20 days from the first day of your cycle. So, from June 2, we would count 20. So, 2, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, and it stops at 21 of June. So, from the first day of your fertile day, which is June 10, it would end at 21 of June. So from June 10 to 21, that would be your unsafe days. So if you have sex during those days, there's a possibility that you would get pregnant. Next are the advantages. So there are I can only provide 3 advantages for the calendar method. So these doesn't have side effects because you would only track down your period using a calendar. Second, no prescriptions or dealing with office visits. Third is it is free or inexpensive because it's only a calendar and you can download it for free in the App Store or Play Store using your phone. Next is the disadvantages. It is only effective 75% of the time. It isn't as effective at preventing pregnancy as the other methods. The effectiveness depends on how consistent you are about tracking your cycle and your commitment to avoiding sex or using birth control when you're fertile. So, a calendar method really is not very trusted when it comes to birth control because first it matters with the body of the woman because some women doesn't have a regular flow and it could distract your cycle count and it would make it inaccurate. So because your findings are inaccurate, there are possibilities that you can have sex during your fertile days even though in your record it is a safe day. So that would be all for the calendar method. So that would be all for this pre-recorded webinar. Once again, this is your host, Duchess Andaya, and my co-resource speakers, Mr. Jonathan Catalan and Ms. Naomi Caneda, giving our gratitude to each and everyone that are listening right now. Thank you for staying with us, and we hope that everyone learned something new today. Thank you very much. Godspeed.